longest ever NHS strike in history is now underway, with thousands of junior doctors today walking out.
It's 6 days of industrial action. It's timed one of the busiest periods for the health service as hospitals struggle, as they do every time this time of year, with rising rates of respiratory illnesses like flu and COVID. Our correspondent, Oliver Whitfield-Miocic, is at the picket line at St Thomas's Hospital in London. We can go live there now. Oliver, good morning. Explain to us, the people behind you have decided not to go to work today. Why?
Yes, that's right. Good morning, Rosie. Doctors have just started walking out of this hospital here in central London in this unprecedented 6-day strike that's now going to last until the 9th of January. It's expected that as a result of this BMA strike action, 200,000 operations, appointments, as well as treatments are all going to be cancelled. Now, the doctors here want their pay to be increased roughly to about 35%. They say that because of inflation since 2008, they've actually had a real terms pay cut. The government is offering on average 8.8%, although before Christmas did come out with an additional 3%. The BMA said that wasn't a meaningful offer. Just as a reminder of what's happening elsewhere in the country, in Scotland, doctors did accept a 12.4% pay increase from the government there. In Northern Ireland, doctors are being balloted about whether they're going to walk out, and in Wales, doctors will walk out for 3 days later this month. Well, for more on what's happening here in England, let's speak to Rob Lawrence, who's from the British Medical Association. Rob, good morning to you. 200,000 operations. This is going to have a huge impact on people across the country.
It's an absolute tragedy, and we need to remember that last year 12 million appointments were cancelled because of mismanagement in the NHS, a fraction of which were caused by strike action. And we need to also recognise that with 7.6 million people on the waiting list that occurred over 15 years while this government was cutting our pay, the government needs to recognise that actually, in order to retain and recruit doctors, you don't do that by cutting people's pay and pushing them away.
But nobody else is getting a 35% pay increase, private sector or public sector.
Well, the fact of the matter is that no other first world country in the world actually pays its doctors £15 an hour. We're asking for £21 an hour. Is that really unreasonable for a doctor with so many skills?
The government says that it is willing to have more talks, but it wants the strikes to end. Is there any chance that if the government came out with a better offer, the strikes would end prematurely, or is this it? For the next 6 days, we're going to have strike action regardless?
No, absolutely. Look, if the government have another offer to make, and it's a credible offer that we can put to our members, then of course the strike action can be averted. And Victoria Atkins says she has another offer to make. So it begs the question, why didn't she make that offer before the deadline? Or why hasn't she made it in the 4 weeks since talks broke down when they pushed us out of the room?
NHS leaders are saying that they're concerned if there's a big emergency or anything should happen, that you will have the doctors in place that will be ready to go back into hospitals. Will that happen?
Absolutely. We have a derogations process where we meet with NHS England 4 times a day. If there's any sort of mass casualty event, like God forbid a terrorist attack, then of course the BMA will ask its members to return to work in the relevant hospitals.
And what's your message for the government, just quickly?
If you have another offer, make it. Don't hold back. Stop these strike actions. Respect your doctors and respect patients and taxpayers. Stop wasting money on these strikes. Restore our pay.
Rob Lawrence, thanks very much for speaking with us here at this hospital in central London. You might have just heard there a vehicle going by, tooting its horn in support. I think for a lot of people in the country, though, this will be a worrying time, especially for those elderly patients. There is concern among some health leaders that they will be dissuaded from coming to hospital, knowing that not all the junior doctors are going to be there to take care of them. Rosie?
Ollie, thank you so much. Live outside St Thomas's Hospital for us.